Welcome back, guys. This is Singh here from Applied Innovation Center, and welcome back to the video series called the Merry-Go-Round video series with Michelle Jenkins.
Thank
Thanks,
you.
Michelle, for coming in.
Pleasure.
Michelle, as we were talking in the earlier videos about the challenges and the issues in the sector, could you elaborate more on what's happening in the whole scheme of space, which is, and the disability, mental health, and the aged care space?
So we know that we've had two Royal Commissions. One of them is still going, the Disability Royal Commission, the Aged Care Royal Commission. Final report's been handed down, and we're now in the process of creating a new act and a new set of principles and policies and guidance and everything that will go with that. In the mental health space, we know that a lot of people are now being knocked back for access to NDIS. Where do they go? What do they do? How do they get appropriate supports? On the other hand, we've got a lot of funding that is being thrown into mental health, but is it actually going to the right areas? Is it going to the spaces where people can be helped? Or should it really be going into NDIS? Is that where we should be going for that funding? I think these are all the challenges that are ahead of us, and we know that the Disability Royal Commission, when it hands down its findings, will have some of this in there, but we don't know necessarily what that's going to look like or the impact that that's going to have.
There's a lot of changes happening, which I can feel and understand. And how do we bring uniformity, or how do people on the other side who are listening and talking to us or watching us today, how do they understand the intricacies of each and every sector and the challenges?
It's confusing. There's no two ways about it. Even for those of us that have been in the sector for a long time and who are working in the sector day in, day out, it's confusing because the roadmap for how we get there is constantly changing. So every single day you're dealing with something that has changed, whether it's in aged care, because now we're reporting on how many of our workers have COVID jabs. We're reporting on that down to the service level, down to the vendor level. There's an FTE impact there on the business, and that's going to impact on the bottom line. How do you follow all of those things every single day? It's very confusing. It's very complicated, both internally and for the workforce. Imagine what it's like for the consumers.
And there are two parts of the play: consumers who are receiving services and small providers who are delivering services in the regional communities and in the metro areas. And if these changes are impacting the bottom line, which means impacting sustainability, how do you feel they are coping up with these changes, and are they ready for these changes?
No. I think a lot of them are not ready for these changes. They're not ready for the fact that the government is pushing a very big digitised agenda. And whilst we might hear that, we might think, oh, well, it doesn't impact us because what they're talking about is the hospital system. No, they're not. It's going to come out into the social system because effectively what they're trying to do is to create one system where, I as a consumer of an aged care service, if I went into hospital, I'm taking a digital health record with me. When I come out of hospital, I'm bringing that digital health record back out into community. Are we ready for that? I'd say no, we're not.
And in the sector, across the silos of disability, mental health, and aged care, is there a conversation happening to find a common solution or find some solution to manage all these regular changes what you're talking about?
There's lots of conversations that are happening, but they're all happening in those little silos. And they're happening, for example, the digital conversation is taking place right now, but it's taking place with IT vendors, the people that you go to buy your IT solution. It's not taking place with the people who ultimately are going to be responsible for delivering those services and then reporting back through that vendor system to the Commonwealth or whoever the funder happens to be. So there are multiple conversations that need to take place, but we're rapidly pushing this agenda forward, and that's going to have a big impact on organizational sustainability.
And the sector bodies and peak bodies, are they coming together to have this conversation, or driving some form of agenda through advocacy groups or through some lobbying efforts with the government?
Yeah. So a lot of the peak bodies are doing lobbying, and they're lobbying very specifically for what they think are the key points, because there's so much change that is happening. You've got to pick a few, and then they lobby around those few that have the biggest impact, not necessarily the other impact. If we take aged care, for example, a lot of the lobbying that is happening is around what is going to happen in residential care. The flow and effect of that into home care is not being discussed. So home care will change. There's no two two ways about that, but it will change based on whatever happens in residential care. That's not necessarily going to work in the home care environment. So we need to be having different discussions, and we need to be bringing all of that information back to the Commonwealth and say, here it is, this is coming from the sector, this is what we can do, this is what we're capable of doing, this is what it's going to cost, and this is the impact that we can then have.
And in conclusion, as there are so many changes, is there a feedback taken from everybody, big, small, and to bring in together a solution and to how to finally survive these many changes?
Everybody's asked.
Yeah.
Commonwealth have just sent out 2 emails, one in home care, one in CHSP, feedback report online. You have to be looking for those. You have to be registered to receive those, to know that they're available for feedback. But really, it's only asking the questions that it wants to know the answers to. It's not necessarily asking the questions that it should be asking in order to get this system right. What will happen is that it will get a certain amount of answers, and those that choose to respond will be the ones that will have an influence on what the system ultimately looks like.
I think what you're doing here is great to bring all these things up to the surface and the conversation, and I think there's enough ground to cover in specific videos. We'll talk specifically, and we'll come back to you with another one on more subjects and topics, and would like you to reach out to us, and if to survive, how to survive the social headwinds, and we'll come back to you soon.